everyone. A very warm welcome to all of you who are joining us for this webinar series organized by the Society for Health Research and Innovation Academy. We truly appreciate your continued commitment to professional development through Sri Academy's CPD program. We are very happy to share that this is the CPD program in Sri Lanka, conducted regularly throughout the years, allowing a large number of participants to participate. As many of us may already know, we've had an overwhelming response to our past sessions, with 500 doctors participating for each program, showing a clear reflection of your enthusiasm and dedication. In fact, due to high demand, nearly 800 doctors attempted to join the previous sessions, but we were limited to a maximum capacity of 500 participants. Today, I'm absolutely delighted to share some good news. Thanks to the generous contributions from our own participants, we have now expanded our capacity to accommodate 1,000 participants for the upcoming webinars throughout the month of July. On behalf of Sri Academy, I extend my heartfelt gratitude to the following doctors who came forward and supported this expansion. Because of your generosity, more of our colleagues will benefit from this valuable program. And for those who wish to support this initiative further, details for voluntary contributions are available in the chat box. Every contribution helps us sustain and grow the program to benefit even more professionals like ourselves. Once again, thank you for your generous contributions and hope we will receive your continuous support throughout. Let's continue to learn, grow, and innovate together. So let's move on to today's session. I will share a few important points regarding the webinar proceedings. You all might know by now. The link to join the webinar will be available until 9:50 a.m. and access to the session will close at 9:50 a.m. As you all know, late attendees will not be admitted thereafter. By participating in this program, you can earn 1.5 CPD points. We all have to remain until the end of the session to receive the CPD certificate because Sri webinar series strictly adheres to NCPT guidelines. We all have to remain until the end of the session, and I hope you will keep your microphones and videos turned off throughout the session. But you can ask questions via the chat option at any time, and the queries will be addressed at the end of the session. If you have a specific question to clarify, you can email us on officesri13@gmail.com, the address shown on the screen. Stay another few minutes after the webinar and ensure you fill out the Google form provided in the chat box with post-assessment questions to receive your CPD certificate through email. This form must be submitted before 11 a.m. today. Please recheck your email address before submitting the feedback form at the end of the lecture, as many doctors do not receive their certificates due to providing incorrect email addresses. Kindly submit the form correctly at the end of the webinar. And please note that you will not be eligible to have the CPD certificate unless you answer the post-assessment questions. So let's move on to the topic then. Future-ready family practice. Electronic medical record integration for better patient care. Electronic medical record, or the EMR, is a digital version of a patient's medical chart used within the healthcare facility, and it helps improve accuracy, continuing care, and clinical efficiency. And let's see how we can have an effective and efficient such system to our practice as well. Hope the session will be really interesting and valuable to ourselves, especially those who are waiting to integrate EMR into their GP practice. Today we have two resource persons, Dr. Priyantha Halaparachige, consultant family physician, Base Hospital, Kiribati, and Dr. Charity Galage, medical officer, Colombo South Teaching Hospital, and director marketing at the Docware Private Limited, who is the sole sponsor for today's session. So the first session will be by Dr. Priyantha Halaparachige, consultant family physician, Base Hospital, Kiribati. As a board certified specialist in general practice with over 28 years of extensive experience in family medicine, with long-term aspiration to contribute to the establishment of high-quality primary care system within the state sector of Sri Lanka, together with the latest developments in healthcare using his experience gained from the overseas training in United Kingdom as well. Over to you, Dr. Halaparachige, to continue with the informative session on electronic medical record integration for better patient care.
Okay. Good morning, everyone. And uh, thank you very much, Sri Academy, for inviting me for this presentation. And in first 45 minutes, I'll be talking about the family practice organization. And Dr. Charita will be taken, he will take over from there to tell you about how to incorporate IT into your general practice. Okay, this is my layout. First, we will be talking about establishment of practice, then HR management, teleconsultations, record keeping, finance and business risk assessment, and also taxation. Before coming to family medicine, you should know there are 6 principles in family medicine. Number 1 is first contact care, and we do patient-centered care compared with doctor-centered care in hospital practice. And we also do the continuity of care because we see the same patient over and over again, and we have the facility of knowing him right throughout. And we also do comprehensive care because we see the patient in the physical, social, and emotional well-being of him or her. Then we also do the preventive care, and sometimes we coordinate care. For example, if a patient comes with a stroke, the stroke patient should be referred to the hospital. After proper treatment, they will refer back patient to us. From there, we will be referring the patient to physiotherapy, occupational therapy, social services, and so on and so forth. So we will be the coordinator in that care. So that is what we call coordination of care. Okay, now our aim is to set up a family practice, or we should upgrade our ongoing family practice to provide better patient care to the patient. So you have to make a decision whether you want to become a primary physician or not. And if you want to become a primary care physician, you should be a very dedicated person and well organized and uh, should be available all the time. Because in the general practice center, you can't put that you're not available because some places I have seen other than a Vasayata. So that means that today the place is closed. So which we should not do. Or else we can put a locum and come back the following day. And we also should maintain confidentiality and we should deliver our services how the patient would like to have. So this is a bit of a challenge. So you should know how to take up this challenge. And because in general practice, we see the patients from birth up to their death. So we will be seeing the breadth of all the illnesses. So you should have basic knowledge of all the illnesses, but not the depth. So depth is seen by the secondary care and tertiary care consultants. So when we see a red flag in our patients, we always refer those patients to secondary care or tertiary care. Okay, and there are 3 ways of becoming a family physician. Number 1, you can resign from the government service and you can become a full-time general practitioner. Number 2, you can be in the government service and then you can do a part-time private practice like me. Or else you can remain in the government sector and you can work as a consultant family physician or family physician in the hospitals because this specialty is there in some base hospitals and in some district hospitals at the moment. Okay, number 1, you should select a practice location. This is very important. So when you are looking for a practice location, you should look at 3 things. Number 1, distance from the house. Then you should know the practice population and also the doctor's population. Because if there are a lot of doctors around you, then there will be a challenge again. And we all will be fighting each other. So I highly recommend. So you have to look for these 3 when you are looking for a location. Okay, talking about the building and the design. So this may be purposely built for a private practice or it may be a converted building. But the place should be motorable. So the patient will be able to come in without any problem. And you should have parking facilities. Otherwise, the patient can't come. In a general practice center, these components should be there. Number one, waiting room, the receptionist counter, dispensing counter, consultation rooms, then procedure rooms, laboratory, storage room, and washrooms. When you are designing a waiting area, this is really important because here the patient should be in comfort. So it should be a well-lit area, and you should have some chairs. I would highly recommend to have armchairs rather than having benches. You know why? Because when you have benches, they try to sleep on. So better to have armchairs. And the talking about the area, this is how you calculate. We keep usually 20 square feet into peak hour patient load into 2, and that is how you calculate it. And you should also have a wash basin, a drinking water, then magazine table, a TV. I would highly recommend to have a channel like Animal Planet or Geographic channel rather than putting these teledramas, and make the sound zero. So the patient will be in a comfort. And you should have a notice board. You can display your consultation times. And also now we can make use of IT again. If you can make a WhatsApp group with your patients, so you can put all the notices in that. So you being the admin, you can put any notice, and patient will see, and they will react according to that. For example, if I'm not working in the evening, if you put a notice that I'm not available in the evening, so they will come the following day. And also, there should be, obviously, there should be a wheelchair. Then the receptionist counter. Receptionist is very important, and she should be a nice looking girl, maybe. But more than that, she should be very obliging and very pleasant girl. And because she should be able to speak to the patients who are coming in, because the patients who are coming is all of them are in distress. So you have to, she has to speak very softly in a manner which she can attract everyone to your practice. And she is the first person to start the doctor-patient relationship. And she will be giving the numbers or uh, the appointments, and she will help you to keep the medical records, either paper-based or electronic. Because even in the system, you need to register the patient, so she will do it for you. And also, she will do the queue management, and also collect the doctor fee, and she will do the queue management as well. So the things need for this receptionist are office chair, table, then the waste paper basket. She need a telephone and computers. Nowadays, we don't use typewriters. And she should have a cash flow machine, filing cabinets, and medical records. And now, I think because of the current trend, we should have a card machine also, because most of the patients pay them by their credit card or the debit card. So better to have the card machine with her. Okay, now coming to the consultation room, this is the most important area in your general practice, and you and your patient and the person who is accompanying the patient should be in a comfort. So the square feet should be around 100, and you should have a table, rotating chair with wheels, then examination beds, then footstool, spotlight, book rack, and a wash basin and towels. Then I will talk a little bit about consultation. Here we do doctor-centered, rather than having doctor-centered, we do the patient-centered consultation, as I told you. So we always negotiate with the patient. And I should tell you how to take the history. When the patient comes to us, we should allow the patient to talk for a while. So that is open-ended questions. So after that, we should ask close-ended questions. Thereafter, quickly go to the past history, social history, drug history, allergy history, and come back to the presenting complaint again. Then patient will not have any hidden agendas. So it's easy to diagnose. And I think we should not request for unnecessary investigations. And we should maintain the doctor-patient relationship as like now, say, boyfriend, girlfriend, the boyfriend should know how to keep the girlfriend with, and the girlfriend should know how to keep the boyfriend with them. Like that, we should know how to keep the patient with us. So it's another type of relationship. So which is called doctor-patient relationship. And there are some good practices you can do. You have to speak to the patient very softly and never use scientific terms. Always use lay terms. And the lab reports, when you uh, telling about the lab reports, always tell the good ones first, then come to the bad ones. Because usually what we do is we tell the bad ones first, which we should not do. And when we are talking to the patient, I think it's better if we can talk to them by their first name, not the surname. Because my name is Priyanta Halambarachige. If you call me by saying Halambarachige, it's a bit official like. But if you call me by saying Priyanta, I'm a bit closer to you. And never call them by Etuma, Metuma, Oya, Mea, Arya, because which are not good. But I don't mind calling them by Amma, Tata, Dvopta. So those are better words. And when a patient comes to your clinic, and always think that patient is one of your family members, then you will never do wrong things. And for a good consultation, in we will be now I'm talking about the technical part of how to organize a clinic, but uh, the knowledge and the skills should be gained by doing coming for programs like these CPD programs, seminars, sessions, and talking to the senior colleagues, and also by doing postgraduate studies like the post PGIM conducts the DFM, that's a diploma course, and you also have MCGP conducted by another college. Then you have MRCGP and also MD. Okay, depending on your experience and the capacity, you can do minor surgeries like wound dressing, suturing, the removal of callosities, warts, and removal of skin tags, then excision of sebaceous cyst, removal of foreign bodies, ear syringing, and nail removals. So it depends on your capacity and your experience. And you should have the following equipments so that you can give a good service. So they should have a patient couch, the footstool, the cupboard for instruments, the emergency drugs, then instrument trolley. They should have a good light, IV drip stand, sharp disposal bin, then the refrigerators and sterilizers. And you should have an emergency room in your general practice. And these are the things that you need to have: the nebulizers, oxygen cylinders, drip stands, ECG machines, emergency tray, which you should uh, at least update weekly, then the sucker, then the intubation tubes. In most of our GP clinics, we have lab facilities. Sometimes you have your own lab, sometimes maybe a collection center. So the basic investigations should be done in these laboratories. Then the dispensing counter. So the drugs what you prescribe in your practice is dispensed in this dispensing counter. So there you should have long tables built in concrete. I think better to tile it. And you should have stools, racks, the medicine bottles, the labels, and paper covers, wash basins, and waste paper baskets. And storage room, yes, you should have a storage room for medicine. So you should have separate racks for that, and you should always have a buffer stock. Otherwise, when you run out of drugs, it's difficult to prescribe medicine uh, from your clinic. And you can always keep dustbins and mops and the cleaning material on the other side. Then the washrooms should be very clean. I recommend to have 3 toilets, one for male patients, one for female, and one for the staff. And you can always keep urinals and bedpans there. Okay, talking about the manager of the practice. So in most GP centers, doctor is the manager. Um, but in the staff, it will include a practice nurse, receptionist, dispenser nurse, and a laborer. Sometimes you only have healthcare assistants. So you should train them to the way you like and to give a better care to the patient. And you should have a staff duty roster, then the leave registers, then you know what's going on. And you should pay the salaries and you have to maintain attendance registers. And you have to do the pay the EPF and ETF according to the labor laws. And if you are unable to make these and make these registers with you, I highly recommend to have a separate person who comes and does it for you. Okay, this is what I do in my practice. I usually have a practice meeting every week. So we sit together and we talk, and the staff problems, patient complaints, the leave of the staff, and staff welfare. And we can always do value additions to our practice by doing that. And we also talk about the repairs and the cleanliness. Okay, now when you are a general practitioner, these regulations, I have to adhere to these regulations. Number one, Private Medical Institution Act, central government laws, then provincial council laws, then Sri Lanka Medical Council rules. And you should always get a BR registration, that is business registration from the local authority, and you have to pay the dues. And you should have you can register your name. I think I recommend don't put these fancy names to your general practice. So you put a nice name and register it and annually pay the annual fee to the local authority. Okay, talking about the taxes, these registers should be maintained. The daily number of patients and income, monthly income, the expenditure, quarterly account summary, the annual returns, and we should pay the income tax and we are entitled for tax benefits. So in most clinics, most doctors, they do it by themselves, but I will recommend if you have a better practice, BC practice, to get the consultation from a tax consultant and do it. And you should open up a tax file in the Inter department with the PIN and the TIN numbers. So these are the equipments needed in your practice. I'm not going to read everything, so you know about it. Then the medical supplies, yes, according to what you are doing. So you should have these things with you. Then the stationery, yes, you should have papers for your computer. Then for your medical records, you should have indexing and coding. Talking about practice audits, you should do actually practice audits every 3 months or every 6 months. This is to deliver better care to the patient, and we do audit cycles on the building, the equipment, the income, the patient care, then the registers and about the records. Just to recap what you know about the audit cycle. So you identify a problem in your practice, you set up criteria and standards, then you collect data, and you have to compare the performance against the criteria and standards. So you implement the change. Then you have to do a re-audit after 3 or 6 months. Talking about the medical records, there are two ways of keeping medical records. One is paper-based medical records and electronic-based medical records. That's called EMR. Paper-based medical records were developed by Dr. Lawrence Weed in 1969. Here you should have the basic data sheet, problem list, then the progress notes, lab data sheets, and if a child, you should have a CHDR. Talking about EMR, I think it's a better way of doing it. Even I have the EMR in my practice. So it's very easy for researchers, clinical audits, collection of statistics, and recall patients for preventive care, and printing prescriptions, referral letters, and patient education, yes, and medical certificates. So putting medical certificates in our system is very, very important because these are a lot of problems with the medical certificates. But if you have a proof, you don't have to worry about it. And you can always put certain tools and the references like BNF to the system. There is a faster and a safer online platform. So we can communicate with the other GPs and with the hospitals. And you have inbuilt prompts and warnings. For example, if the patient is allergic to certain medication, it will tell you that this patient is allergic to this drug. So you're not going to prescribe that. And as I said, you can insert the clinical tools into the system. So it's easy for your references. And you can have electronic links to the labs, radiology departments, and also the pharmacy. So if you have links to the labs, you can get mm, uh, the the laboratory results to your screen. So no need of printing the lab reports. So it's easy to see, and you're not wasting paper. And even the radiology department, then the X-ray can be seen on your screen. So no need to get a printout. So I think it's very easy. Actually, I don't have pictures or slides of my practice to show you how the system works, but I was working in the e-hospital Dompe before I came to Kiribati, so I will show you some slides on how we manage the patients at e-hospital Dompe. So this is a model hospital. So in the past, we had long queues and long waiting time, as congested, yes. And we have kept the medical records, which is everything in the same place. It's not methodical. So quality care compromised. So we re-engineered with the computer system. So we had this wired network with a server, yes. And we did a once in a lifetime registration in the receptionist table. And we gave them a card with a barcode. You can always have a QR code with it. And we managed the queue electronically. And doctors were given barcode scanners and laptops in their working places. Then we automated the dispensary, and it was very easy. This was uh, very good practice during the COVID times. So we are not touching anything. We can just dispense because the prescription comes to the dispensary electronically. So it's in the system. So we automated the injection room and the bleeding room. The dressing room automated, laboratory automated. Here we incorporate the 5-part analyzer into the system. So we got the reports onto our screen. And the emergency ETU unit automated, yes. Then the OPD wards, yes, the wards also we can work with a system, because we were in a Wi-Fi zone. So if you use iPad or whatever the device, you can add the data, the patient notes into that. So it is directly going to the server. But still, the BHD is a legal document. So it's better to have a BHD to a patient. The psychiatric clinic, automated. Then the family medical clinic, yes. Then the dental clinic. And we were able to notify the notifiable diseases electronically to the MOH. And we got system generated lab sample slip, which is a sticker slip, so that we would be able to paste it onto the tube. Then EIMMR was started. Yes, and this is how I am now. This is my own practice at Gampaha. This is my consultation room. You can see the computer. This is my waiting area. Again, the waiting area. It's my lab. Yeah, this is the procedure room. And this is the counter. Again, this is the receptionist table. You can see the wheelchair there. And this is how it looks from outside. And thank you very much for listening to me. And if you have any queries, you can always ask me. And I can tell you my telephone number. So if anybody wants to ask anything, you can call me at any time. You are free. Feel free to call me. And number is 777-687-987. Okay, thank
Okay,
you.
thank you very much, sir, for that informative lecture on how to establish an effective and efficient GP practice in Sri Lanka. We learned a lot of details and tips to incorporate into our practice as well that most of us have overlooked. So most of the comments have also shown that the session is really interesting, and we will discuss the questions at the end of the session, sir. And because there is another session on how to integrate information technology to our practice.
Okay, thank you
Our
very
next resource person will be the sole sponsor for today's session, Dr. Charitri Galage, a medical officer at Colombo South Teaching Hospital and Director Marketing at Doctor Private Limited. On behalf of the Sri Academy and all our doctors, I would like to pay my heartfelt gratitude to Dr. Chariti Galage for sponsoring today's program. And he will be discussing about the integration of information technology and EMR to our general practice. And also, he will be discussing about the Doc Wallet app, which is an electronic medical recording app developed by Sri Lankan doctors and IT specialists. So, while thanking again, I would like to invite Dr. Charit Vigalage to continue with the session.
Thank you very much for that kind introduction. So, this was back in 2017 when I started my first private practice back in a village called Mandapattadi, which is a rural village back in Batticaloa. One fine day, there was one Mr. Nallaya who was a 54-year-old gentleman who came with very basic sore throat, fever, mild fever, and a runny nose. So I took a basic history and specifically I asked about the allergies, which he denied, and then did a basic examination and put Nallaya on basic medication, including a small antibiotic like cefalexin, and I let him go home. After like 2 to 2.5 hours, he was taken back to the dispensary with a facial swelling and difficulty in breathing. To find out his BP was low with bronchoconstrictions, to find out that he was in an anaphylaxis. I was concerned. I managed the patient's emergency part and then transferred to a hospital, including giving him adrenaline. And then I was concerned, and later I was thinking, what actually has happened to the patient, because he denied any allergies. Then I got his family down like a couple of weeks later, and wife said about a year and a half ago, he has had a similar like mild allergic reaction following an antibiotic, but he keeps on forgetting it. At this point, I realized the importance of keeping a medical record for each and every patient, even if they are clinic patients or just day-to-day cough and cold patients. But in 2025, how practical is it to maintain one room full of medical records and books and papers full of patient details? And how difficult is it to access them whenever a patient walks in? Just think about it. You will have to have a separate person, a clerical person or a Piyadasa, just to run and get down all these documents and come back to you whenever a patient comes. But this is a must. This is how all the general practitioners, qualified general practitioners, have been practicing for the past decade or two. Back in 2025, actually like 5 to 6 years ago, we were discussing among one of a few of our colleagues how to overcome this problem. We have been trying all the commercially available or free available medical recording apps which are developed in India or Pakistan or any other country. But we found out the problem is that does not suit our system in Sri Lanka. So our team have developed, after years and years of research and development, a final product named Doc Wallet. So let me take you through the ultimate medical recording app, which is developed for the Sri Lankan doctors. Once registered, you will be given your own login details, username, password, and a 2-point verification PIN number. This is a cloud-based app where all your data will be saved in Google Clouds with security similar to all the hi-fi social medias. Data protection is to a level that is similar to Facebook, Google, and all the other commercially available apps. Once you log in, you'll be taken into a screen where you have to enter your username, password, and this is the interface of your web app. There are the logins are unlimited. You can use unlimited number of mobiles, tabs, or laptops to gain access to that. Even if you lose your laptop or phone or tab, this is still available. All the patient details will be available to you at your fingertip with your username, password, and the PIN number, because everything is saved in a cloud. Let me show you an example. There is a separate tab given for the assistant, which is restricted, which all the other tabs are restricted. As you can see here, there are 7 tabs. The first part is your tab, where you add a patient and the patient's detail and everything. The next tab is for the assistant. Now we'll do an example, then you will easily realize how easy to use this app. Now your assistant is given a tab or a laptop with this restricted tab, where when the patient comes in, you can search the patient. We will say we are Nandini Pereira has come to take medicine. So there are 3 methods to search the patient's details: using the name, telephone number, or QR code, or later using the NIC. So once the assistant search for Nandini Pereira, the Nandini Pereira's limited profile will be seen to the assistant, and she can push that to the doctor, send to doctor. So when we open the doctor's tab as the doctor, you will see the available next patients here. So Nandini Pereira is waiting in the waiting room. Even before Nandini Pereira comes in, you can load Nandini Pereira's profile, and at a glance, it shows you the allergies that she's having and all the details about the last visit. So she had come in her last visit with a urinary infection, fever, and dysuria. You can open this tab and see the medication that you have given her and all the past records with no limitations for years, decades. You can save this patient's details inside this tab. So each and every tab, you can go back and see the medications that you have given, and also if you need a repeat prescription or a bill, anything printed out from the past, you can do it. Now, when we are practicing in our general practices, even if we have kept records, it could be for 1 year or 2 years, and there is a chance of losing it for the rain or by rodents or by termites. But these details will be saved until the Google Cloud lasts. So once you go back to Nandini Perera, now this time when you are consulting her, taking the basic history, you can search the diagnosis. Imagine now she's coming with a sore throat. You just type couple of letters and the app will be suggesting you the differentials. Using that, you can come here, and if you prefer, you can type in the further complaints that she mentions. So fever and cold or whatever, depending on your time, depending on your typing speed, you can use all the details. Then additional notes, you can just put in, imagine now that this additional note is kept open for you. So you can put things like your specific examination findings, or even things like the patient's personal preferences. Now, best example that we are using is, imagine this is one of your mother's friends and you keep on forgetting it. So you can simply put it there, because the moment she comes in, it shows that this is this person. The profiling of the patient, including all, imagine their maybe political interest, maybe their job interest, maybe their family commitments, whatever, that will let you build a rapport with your patient. So imagine when Nandini Pera comes in, you know this is your mother's friend, and you know that she visited with a UTI. Imagine the moment she sits down, you tell, hello Nandini, how are you? කොහොමද නන්දනී වාට ගිය පාර මුත්‍රා සාධනට බෙහෙත් ගත්තා නේද? දැන් හොඳයිද? She'll be surprised. Imagine, isn't this the type of rapport that you need to build with your patient? Imagine she comes with the clinic book, she comes with the medical record offers. That's how most of the doctors practice, and you have to go through the book looking at everything. But imagine when she walks in, you know everything about this patient. That is the type of care that we are introducing through Doc Wallet. Then here you can now imagine she has a sore throat, fever, cold. You need to give her cetirizine. There is a drug storage. I will come back to that and show you. Depending on your preferences, now imagine this is how you prescribe. You just type CE, cetirizine comes in. You decide whether you are giving it in the morning, night, or twice a day according to your medical knowledge. Then for how many days? Now see, the app is, we can preload the amount of each tablet, and the app will be calculating the amount that you are spending and the number of tablets that should be given. Now imagine you want to give something like cefalexine for this patient. We have ceviroxime, which is an outside drug. We'll give amoxicillin. The drug database is completely editable, and you can use it according to your preferences. So we'll pick some drug that you want to give to her and then put it there. Similarly, now you can keep on adding drugs, and then you can also, once you confirm, this will be pushed to the assistant. In this tab, if you want to give, imagine some doctors, they prefer giving some drugs stat, or you want to give it then and there. Imagine the patient comes with a little bit high pressure, you want to give a small dose of amlodipine or some medicine that you prefer, and keep the patient in the waiting room and review. These instructions you can put in this tab for the assistant. Once you do that, that will be pushed to the assistant tab. So all assistant has to do is open Nandini Perera, and everything will be seen here. The drugs that you have prescribed, the total number of tablets that she has to calculate and put, and this will be reducing the drugstore real time as you prescribe. When you prescribe 10 tablets of cetirizine, that 10 tablets of cetirizine will be reduced from your drugstore. So the assistant is given the chance to print a bill as well. So you can decide which drugs that you have inside your drugstore, and the outside drugs you can separately store them. We'll come to the patient database. In the patient database, all your patients will be saved here as you keep on adding them. So for the past 7 days, how many patients? Past 30 days, the patients who have visited you, the patients who has come to you yesterday. So using these details, you can see the patients that you have to attend. Imagine now you go home. All of a sudden, maybe when you are watching TV, you remember, I have seen a patient, but I forgot to ask them to come back using with a full blood count and a CRP, or maybe with an X-ray, or I forgot to schedule their next visit. Now here, when you are clerking the patient, you can actually plan their next visit. Imagine you want to give some medicine and review in 3 days. You schedule it then and there, and the machine will notify you. Your app will notify you. And you can also use the SMS function to send an SMS to your client and remind them to come back and see you. This is an integrated system which gives you a whole new revolutionized power as a doctor to use the most updated technology in your private practice. So here you can categorize your patients according to their presenting complaints or their category. Imagine all the pediatric patients less than 12 will come into one tab. All the gynecology cases will come into one tab. So it will be very easy for you to store the patient details. You also can search them by mobile number. Under one mobile number, you can add the whole family as well. So you can save them using their name. The drugstore, usually we provide you a drugstore, the basic drugs typed in. So you do not have to type and add each and every drug. You can just download the whole system which is provided. And using this, you can also use your own set of drugs, and outside drugs, you can type and enter. So once you enter them, this is categorized into tablets, syrups, creams, droppers, and other treatments, any other treatment. Especially for the aesthetic doctors and consultants who are using different modalities of treatment, they can use this other system to insert all their drugstore. So in the drugstore, if you can see here, you can specify the unit price that you purchase, or buying price and the selling price, or you can use the same price in your tab. Now this will be maintaining a real-time running accounts where how much you are spending on the medicine and how much you are gaining according to that. Coming back to the add patients, as I told you, once you imagine, enter the patient's details, we'll say you want to give some cetirizine and you want to give, we'll say prednisolone, and the machine will automatically calculate the amount that the drugs will cost you. And there you can put the doctor's fee here. You can keep it fixed, or you can put different numbers according to your patients. Imagine if you have 550, or we'll say 600. Then once you confirm it, that will round off to the nearest 50 rupees and send it to your assistant. At the end of the day, the machine will show you how much you have collected, how much you have spent, the revenue generation, and everything. Now this is something that we have seen in many private practices. The assistant is the one who decides the amount, and the assistant is the one who takes the money. And in the end of the day, even if they give you 1,000 or 2,000 rupees less, then you don't know whether the calculation was right or not. Imagine 1,000 rupees a day means if you open 30 days, that's going to be a 30,000 loss. And also imagine if an assistant, these are things that have been reported in many doctors, even the doctors that I know. Imagine your assistant keeps on stealing from you medicine, one box, or one box of mechanizole, one box of, we'll say, few tablets of azithromycin, few tablets of coamoxiclav. Imagine the loss that you can have at the end of the month. So if you use a real-time updating system where you insert each and every time you buy the drugs, you insert that into the system, and then at the end of the stock, the drug should over. And if the drugs are finishing before the stock, then you know there has to be a problem in the management. So these are in the dashboard, it shows the number of patients, number of revenue generation according to your days, weeks, months, and the SMS facility will give you the opportunity to send an SMS to each and every patient. Imagine you need to send a bulk message saying in this weekend that you are going on a trip, that you are keeping a locum doctor and going. You can use all the patients and type in your own message. Sinhala, English, and Tamil fonts are supported once you subscribe to this service. You can send this, and you have to reload and use this account to send messages to the patient. And also imagine individual, you can use this individual function. The patients you have seen and you are planning a next visit tomorrow. It shows the patients that you have planned a next visit tomorrow. So you can send a message to them saying your next visit is planned for tomorrow. Please come with a full blood count, CRP, and a chest X-ray. So like that, imagine how nice and how sophisticated your private practice would be once you shift into the Doc Wallet system. So there are settings and configurations. You can decide how much access that you are giving to your assistant and how much access you are giving to your locum doctor as well. There are options to use your own templates of medicine that you don't have to type in each and every time. And there are options to print your own medicals and your own referrals, and all that our team will help you to customize according to using your logo and your signature and your seal. So this is the basic introduction to this system, that how Doc Wallet or an electronic medical recording app can be used to upgrade or revolutionize your general practice as well as your private hospital, nursing home, or any aesthetic or consultation practice. We have planned a free demonstration for the doctors who are interested in purchasing. We usually charge the joining fee and introductory fee of 25,000 and monthly fee of 6,500 with unlimited access, unlimited uploads, unlimited devices. I'll be sharing my details so you all can contact us directly, and we'll add you to a demonstration which is planned for 5th July, 11 a.m. and 12 noon. After the full demonstration, you can decide on the purchase. My contact number is 0777 130 997. I'm Dr. Charita V. Galge, Director Marketing of DocWare Private Limited, the Doc Wallet team. It's 0777 130 997. And I would like to thank Dr. Priyanta for that informative lecture that led me to, it made my life easy to introduce you to electronic medical recording. Actually, sir has developed a very integrated system in his hospital, as he said. That was very nice, sir. Thank you very much. And I would like to thank Sri Academy for giving us this opportunity to introduce our system to the doctors of Sri Lanka. Thank you very much.
Thank you, Dr. Charit Galage, for your valuable lecture on how to integrate electronic medical records to our GP practice. And there are several questions we have received. The first question is there any place for telemedicine in this?
Yes. Now, that's a very good question. Thank you very much. This is actually the first app that we have launched, and the next app for the patients are under development. So once that is launched, the online consultation or the patient's, the consultation bookings and everything will be available for the patients as well. Imagine now you have a patient base of, you'll say 500, you can get all your patients to download that app. Even if you're not in Colombo, even if you're not in Sri Lanka, your patients can have a online consultation as a video call or the direct audio call, and you have all the data in your in your app. So you can prescribe and send them a PDF prescription or even a referral or even a medical for that concern. Yes, telemedicine will be available in the future. At the moment, this we are launching for the dispensaries for the in-person consultations.
The next one is, what is the legal background for EMR in Sri Lanka?
Actually, we have a legal team separately running this. Actually, we have the NHS EMR trainer who has been training the doctors for EMR in the UK in our team. So all the legal background has been covered. The problem here is the patient's data safety. A lot of doctors ask, now this is very sensitive data. Your prescribing patterns, the drugs that you prescribe, sometimes the brands that you write, all these are very much of confident data. This is protected by the patient-doctor confidentiality. So that's why we are giving you a end-to-end encrypted data saving method in the Google clouds. So this data is not recorded in our servers. Even if our servers are down, this will be still available because these are available in the Google cloud, Google servers. Then this is only accessible for the particular doctor with the username, password as well as the PIN number with two-point verification. Even the developers from our side, all what we see is just encrypted data. So the confidentiality is protected, and patient data and your prescribing patterns are protected.
The next one is there inbuilt online reference forms for allied health and specialist health?
Yes, you can have your own what do you call the referral system and your specialist registry in this system. You can refer your patients into the specialty that you prefer. Even you can have your seal, your logo, everything will be designed by our team with a small cost for all this designing. And even without a design, imagine now, this is a question that we get from the most of the doctors. I have already printed, we'll say 10,000 of my letterheads. Can I use this for the same map? Yes, you can remove the header and footer and use this system and print it in your own already printed letter heading. So all the options will be disclosed at the demonstration. You can join it on 5th July.
Okay, thank you, Dr. Charit. The next question is, I think it will be better answered by Dr. Priyantha Halambarachige.
Please, sir.
Sir, what is the accepted method of disposing sharps out from a private practice in Sri Lanka? Do hospitals accept such waste to incinerate along with their own waste?
Please, sir.
Yes, Kanchana, now, I think that's a very good question. Now, even I have the same problem. But what I do is I have a lab which is run by a private hospital, and they have a sharp bin. So what I do is even my clinical waste, I collect it and give it to them. So they take it and they dispose it. Or else there's a problem of disposing sharp objects. Yes, that I agree. But I spoke to the local authority. They say if you put it in a separate bin and give it to them in a separate what you call a bag, sometimes they are also willing to do it. But I don't know how they are going to do it. I think they should do it with the hospital disposal.
Okay, so the next question is, when the patient goes to another hospital for another reason, how can we provide the medical history without a clinical record?
Well, I think we should write a referral letter for it because up to now the electronic systems not integrated. But very soon, if the government allows us to do it, we will incorporate everything. So I spoke to you regarding the hospital project at Dompe Hospital. So there we give a barcoded uh, card to the patient, which contains actually it's 11 digits. The 4 digits is a code, and the other digits are the patient number. So when we link to these hospitals, any hospital have the access for the medical records from the other hospital. So in that way, we can refer the patients to that hospital, or else up to now, what we use is the referral letter. So you should write a nice referral letter to the next level. And but if it is an emergency, we will straight away send the patient to the hospital. Or if it is not an emergency, we can write it to a particular consultant, but not in an emergency. Emergency to straight to the hospital.
Okay, sir, thank you very much. And there is another comment saying that no one have taught us these things. So that shows that how interesting the lecture was. So,
Nice to hear that.
so thank you very much, Dr. Priyantha Halambarachige, consultant family physician, for your informative presentation on future ready family practice, and Dr. Charitri Galage, for explaining how to integrate the information technology to general practice. And
Thank
both
you,
of our
Kanchana.
resource personals gave us a good understanding of how to integrate the electronic medical record system into our general family practice, as well as how to establish a good general practice in Sri Lanka. And special gratitude goes to Dr. Charitri Galage for being the sole sponsor for today's entire program. And it enabled more than 500 doctors to have access to a reproductive session. And for those who wish to support this initiative further, details for voluntary contributions are available in the chat box. So it concludes our session for today. Thank you all for joining today's free program. As mentioned earlier, the link for feedback and post-assessment questions is now available in the chat box. Kindly provide your feedback and complete the post-assessment to receive your e-certificate within the coming week. The Shri program will continue next Sunday as well with another relevant topic. We warmly invite you to join us once again for another productive session. Thank you, Dr. Priyantha Halabarachge and Dr. Charity Galage, for your time and for sharing your expertise. And thank you to all the doctors who participated today. We look forward to seeing you again next Sunday morning. Thank you and have a nice day.
Thank you, Dr. Kanchana.